Today in the Tesla Model X, we're going to learn about the big 5 ways of managing chronic pain. Stuff you can do right now to live in less pain. Shall we? The Model X. With up to 295 miles of range, this electric SUV takes the pain out of filling up. However, going from 0 to 60 in 3.1 seconds could definitely put a kink in your neck if you're not careful. Featuring a beautifully aerodynamic design and top-of-the-line features, Model X is the safest SUV ever created.
We're getting our speed needs met.
I know, right? Dr. Theo De Gagne. He's a registered psychologist and has served as the regional practice leader and director of the Vancouver Coastal Health Region. Let's see what he can teach us. So we're going to talk about chronic pain. Explain to me what chronic pain is. What does that mean?
Chronic pain is usually pain that exists beyond the time of normal healing.
When does someone with chronic pain know they have to go to a psychologist as opposed to just going to like a physiotherapist?
One of the first red flags are often mood.
Mood?
About 20% of people who have chronic pain are also depressed.
Right.
And now I have to start addressing it differently.
So what can you do just in general? Like, are there some simple ways to deal with chronic pain?
Sure. I'm thinking of the big 5.
The big 5
it's
tips.
Easy to count on my hand.
Okay.
The first one that I'm thinking of is relaxation. We want to stop this pain, tension, anxiety cycle. So we need to teach you how to breathe.
Okay.
What will happen if you're not breathing?
It's uncomfortable.
Yeah, it's uncomfortable.
Yeah, right.
But often when people have pain, they'll hold their breath. So we teach people how to breathe because it closes the dorsal horn in your spinal column, and basically it decreases pain levels.
Right.
And that's tip number 1. Tip number 2, pacing. If you're the type of person whose self-worth is based on how much you do every day, and you have a lot of pain, you'll be doing as much as you possibly can. You're working long hours. I'm going to talk about your life now.
I'm going to put this on autopilot and I'm going to put my seat back.
Okay. With pacing, we teach people how to do less.
Right.
If you're driving, you might take 3 rest stops so to take care of your back.
That makes sense.
Yeah, be compassionate with yourself a little bit. Number 3 is self-talk. What kind of things are you saying to yourself? One example would be shoulds. So how do you get your needs and wants met without shooting on yourself?
What did you say?
How do you get your needs and wants met without shooting on yourself?
Oh, shooting.
Shoulds equal guilt. Can you replace that with a need or a want?
Right. It's almost like a word choice in your head.
That's exactly right. It's word choices.
Okay.
Let's do number 4.
Tip number 4.
Sleep tips.
Sleep tips. Okay, got it.
By the way, we all wake up every 90 minutes.
Really?
Yeah, but you'll just roll over.
Right.
People with pain, when they wake up in that 90-minute cycle, they'll wake up and go, ow,
Right.
I'm sore. So if you can't get back to sleep, what we want you to do is something that is very boring.
So what you're saying is that my videos would probably help the world become a happier place.
That's right. That's perfect. There you go. Something boring. So here we are at the top of the mountain.
Tip number 5.
Communication. If I'm giving you subtle hints all day about my pain, it's not really that helpful. And a lot of times pain is just invisible. It's this invisible disability. And people put all of this pressure on themselves to say, well, they don't know I'm in pain, and I'm not going to tell them because if they do, they're going to judge me.
And that just makes everything easier for dealing with chronic pain if people around you know why you're acting the way you're acting. And
Exactly.
Right.
That's it.
Fantastic.
5 tips.
Amazing.
Thanks for letting me ride along.
It's fun. Fantastic. This car is amazing, isn't it?
I'm so enjoying it. I don't want to get out.
I know. I know.
Could you drive me home, please?